Welcome everyone to today's webinar, Too Critical to Compromise Selecting Exam Gloves for Safety and Savings. I'm Brian Zimmerman with Becker's Hospital Review. We'll begin today's webinar with a presentation and we'll have time at the end of the hour for a question and answer session. You can submit any questions you have throughout the webinar by typing them into the Q&A box you see on your screen. We're looking forward to hearing your questions. We also have a series of audience polling questions during today's webinar. When we reach each poll slide, the poll question will pop up automatically on your screen. Our speakers will give a few seconds for you to select an answer from the options on your screen and click Submit. Thank you in advance for your participation. Today's session is being recorded and will be available after the event. You can use the same link you used to log into today's webinar to access the recording. At this time, it is now my pleasure to start today's webinar by introducing our first speaker, Samantha Hoy. Samantha is the Global Vice President of Exam Gloves and Medical Essentials at Cardinal Health, where she oversees business and marketing strategy. Samantha has over 20 years of general management, marketing, and new product innovation experience in retail, pharmaceutical, and financial services. Samantha is passionate about supporting children to help them achieve their goals, and she is actively involved with the Juvenile Diabetes Research Foundation and Junior Achievement of Central Ohio. Samantha lives in Westerville, Ohio with her husband and 2 children. Samantha, I'll now turn the floor over to you to begin today's presentation.
Thank you, Brian. Hello and welcome. We're really excited to have you here today as we talk about standardization. Standardization is a strategy that has been proven to improve efficiency and reduce costs in the healthcare settings across America. But we've uncovered a challenge with standardization when it's applied to exam gloves. So today we'll discuss the impact that challenge presents in hospitals and health systems, and more importantly, how to address it. When standardization was introduced years ago, it was touted as the one right answer. It would help providers save money without impacting safety or quality of care. But as we all know in life, there is no such thing as one right answer to every problem. Regarding standardization of exam gloves, what we know is that staying on the current path is revealing some unforeseen risk. Standardizing to one single exam glove for all settings is having a pathological, physiological, and financial consequence. We call this challenge excess standardization. And after this webinar, you'll have new tools to help you overcome it. Rest assured, we're not advocating for the elimination of standardization. Far from it. Rather, we're recommending that you bring it into balance. This will help you achieve what standardization was originally intended to do, saving money while supporting safety. These are both benefits that are too critical to compromise. The good news is that you don't need to compromise. You can select exam gloves for both safety and savings if you use the right strategy. So let's get started. Let me just share a little background about Cardinal Health. With over 40 years of experience, Cardinal Health is a recognized leader with top ranking for transforming the healthcare supply chain to meet challenges around cost, revenue, and outcomes. In particular, we're a leading medical and surgical distributor for surgical hospitals and ambulatory surgery centers. And for more than 40 years, we've been a leader in providing supply chain services that include helping hospitals and health systems identify new ways to save money without impacting quality. And as part of our commitment to cost-effective, quality care, we're discussing the impact of excess standardization. And we'll cover 3 main objectives. 1, understand the risk of excess standardization. We'll talk about its origin and its impact to the clinicians based on 3 risks: pathological, psychological, and financial. During the discussion, we'll learn from clinicians' view the importance of choosing the right exam glove for the right clinical setting. The right glove for the right setting can have a significant impact on mitigating the risk of excess standardization. Then we'll wrap up the webinar with a strategy you can use to standardize your exam gloves without compromising safety for your staff. But before we get started, I want to introduce you to 2 clinicians who are here to share their perspectives on the impact of excess standardization and how they've seen ways to overcome it. To start out with, Rosie Squio is the Senior Consultant for Clinical Operations at Cardinal Health. She has more than 25 years of clinical experience within a variety of medical organizations, including 16 years in OR management. She began her career as an OR staff nurse, so she knows from direct experience the value of choosing the right exam glove for the clinical setting. And so does my guest, Jane LaCavora, who is the clinical nurse specialist for Banner University of Arizona Medical Center in Tucson. Jane is an advanced practice registered nurse and is board certified as a clinical nurse specialist and expert in adult health. She provides consulting services to high-risk patients in an academic medical complex, including 2 acute care hospitals and a National Cancer Institute designated cancer clinic. In her role, she focuses on preventing complications in high-risk patients. So I'd like to welcome you both.
Thanks, Samantha. Happy to be here for this program.
Thank you very much, Samantha.
So let's discuss the origins of standardization. So standardization, we hear the common phrase, we need to standardize across all hospitals in America. But what is it? Simply put, it's really the best practice for improving efficiency and reducing costs. And standardization accomplishes this by decreasing the variation of medical and surgical supplies, which should yield to the benefit of a lot of things you're probably familiar with: reduced waste, lower inventory, less storage costs, decreased labor, and SKU rationalization. But there may be a hidden problem that hospitals are not aware of. Rosie, I know you're in the hospital systems all the time. What have you seen?
Oh, about 8 or 9 years ago, the trend was to standardize to a single nitrile glove for all clinicians to use on all units, plus an additional chemo glove. Then about 3 to 4 years ago, I started to hear from staff members about the impact of converting to a single glove. This is when we started to recognize the impact of excess standardization. We were hearing concerns from personnel in many areas of the hospital, including the ICU, ER, decontam department, pathology, and housekeeping. Since then, clinicians have continued to speak up, and supply chain professionals are listening. The message is clear. We need to match the exam glove to the task at hand and how long it will take. In particular, we really need to have glove choices in some high-risk specialty areas. This isn't just coming from staff members I talk with. According to independent nationwide market research, more than 1 in 3 clinicians surveyed believe their facility is beyond the ideal level of standardization. Samantha, I'll now turn it back over to you to introduce the risks that excess standardization can cause.
So as I've mentioned, there are 3 critical risks. One is a pathological, second is psychological, and third is the financial. So if we look at pathological risk, this is really when the clinicians could be unprotected by wearing the inappropriate exam glove for a particular clinical setting. And that leads to, quite honestly, a psychological risk. And what we found is that clinicians may feel very undervalued because their facility isn't providing the right exam glove for every setting. And when that happens, there's a financial risk that comes along. And this could be a cost per patient of exposure and treatment that could be fairly substantial, reaching as high as $60,000. Jane, based on your experience, what do you see, what happens when people don't make the right choice?
Well, yes, Samantha, it's really easy to choose the wrong exam glove if you have no choices. That's why it's so important to have the right glove available for the right setting. In a minute, I'll share the impact of these 3 risks from my own personal perspective.
Great. Let's discuss the first of the 3 risks of excess standardization, which is really pathological. I think we can all agree that exam gloves are really meant to protect the hands that they heal. Clinicians literally use their hands every day to do their jobs, and they can't afford for their hands not to be at their best, or for them to not be at their best. So they deserve the right level of protection for each setting. When they know they have it, it puts their mind at ease, and they can focus on what matters most, the patient care. But excess standardization can compromise that peace of mind. Rosie, have you had some experiences that you can kind of share and some data points around the importance of this?
Oh, yes, certainly I have. Excess standardization can compromise employee protection, leaving them unsafe and exposed to health risks. In addition, it can seriously affect their peace of mind. The statistics are eye-opening. Nurses are among the 44% most likely to be exposed to blood and body fluids. About 8,700 healthcare workers are infected with hepatitis B each year, and 200 die annually each year. Jane, what has your experience been with the pathological risks of excess standardization?
Well, yes, I agree completely with Rosie, because when it comes to exposure risks, we've now moved into a new era. In the last 5 to 10 years, things have really changed, because originally we were concerned primarily with the potential for chemotherapy or hormonal exposures. But now there's been an explosion of not only biologicals, but also immunotherapies. Biologicals are not synthesized chemically, but they're made by cells. These include monoclonal antibodies, proteins, and macromolecules. I'm seeing a number of new risks with the rise of these new anti-neoplastic agents to fight cancer. For example, there can be an impact on reproductive outcomes, the potential for cancers among providers, and the risk of skin rashes. Is it any wonder that OSHA recommends that we always choose the thickest glove available that has the right amount of dexterity for the task at hand?
Jane, I appreciate that perspective. And as we've discussed, the risk of exposure to pathological agents are real. And one of the most common is blood and bodily fluids. So we're going to go to our first polling question. And as a reminder, you can answer this on your screen. And for all of our clinicians out there that wear gloves every single day, we'd love to hear your feedback. So poll question number 1. Do you believe that you have been exposed to blood or bodily fluids as a result of a glove failure? All right, let's see what the survey said. So according to our webinar poll today, 57.5% of you who have responded believe you've been exposed to blood or bodily fluids as a result of a glove failure. Let's take a look at how that compares to a broader nationwide audience. While our poll indicates that 57% of the audience has been exposed to blood or bodily fluids as a result of a glove failure, our nationwide survey says it's 56.9%. Rosie and Jane, I'd really like to have your point of view on what you see as the differences here.
So yes, I think that many people have been exposed on the job, and I think it's a concern for their personal health.
So in that same nationwide survey, we also measured the exposure risk in several other categories. So let's take a look at those results. In addition to blood or bodily fluid exposure, we asked a group of clinicians if they believed that they could have been exposed to a variety of other agents due to a glove failure caused by a tear, puncture, or a leak. And here's what they told us. Approximately 1 in 5 said yes for exposure to sharps, MRSA, and C. diff, while 7% feel like they may have had an exposure to chemotherapy drugs. Jane, Rosie, do you have any comments on that?
These results sound a little low in my experience. Just about everyone has had an exposure incident, and I know that I have personally experienced several myself.
I agree. And the further along you are in your career, the greater the odds are that you've been exposed at some point. Plus, you don't always remember every single exposure incident you experience. I'd like to make one more comment as well about chemotherapy drug exposure. They aren't just in cancer clinics anymore. They're throughout the healthcare system, which can also increase your exposure risk. For example, the ICUs are running high-dose chemotherapies. The operating rooms are infusing chemotherapeutic agents directly into the tumor or into other parts of the body cavities. We're now washing the area of the body with chemotherapy agents. All of these possibilities increase your likelihood of exposure.
That's great. Thank you both. So let's move on to talk a little bit about the psychological risk as a result of excess standardization. Personally, I'm in awe of what the clinicians do every single day. They come to work to save lives. So the last thing that they need to worry about is whether or not their glove is going to fail. They have the desire to stay focused on what matters most, and that's the patient. And it's just not fair. And the psychological impact of an exposure incident is well documented. Many exposed healthcare workers report psychological symptoms that have been attributed to their exposure incident. Over 50% report anxiety. while almost 20% don't sleep well and have insomnia, and 13% have depression. Jane, we've talked a little bit about the psychological risk. What are some of the emotional impacts you've seen?
Well, the emotional impact of an exposure incident is very, very real. Imagine the anxiety a pregnant nurse feels when she's been exposed to one of the new agents. This is what clinicians think about when they go home and lie in bed at night. That level of anxiety makes you do things you wouldn't ordinarily do. For example, donning 2 or even 3 pairs of exam gloves.
That's perfect. That leads me right to poll question number 2. So, as a reminder, all of our clinicians out there on your screen, we'd love to have your opinion here. Do you double glove at least some of the time? So go ahead and cast your vote. All right, let's see what the survey says. All right, according to our webinar polling results, 70% of you responded that you double glove at least some of the time. So let's take a look at how that might compare to the national broader audience. So according to our webinar polling results, it's pretty much in line. 70% of you say you do. In a nationwide survey, the number is 76. So why are clinicians double gloving? And let's turn once again to our nationwide survey for some jarring results. Glove failures are a reality. According to this independent nationwide survey, nearly 9 out of 10 clinicians have experienced glove failures in the last 3 months. More than half of them are due to torn cuffs. So gloves are indeed a reality. So Rosie and Jane, would you concur with these statistics?
Oh, definitely. As a matter of fact, I have also heard the same from clinicians I've spoken with. One ER doctor in particular told me he always dons 2 pairs of gloves when performing a rectal exam, as it keeps his peace of mind. Many ICU nurses have made it their practice to always double glove because they do not trust their gloves will protect them. I believe there has been an increase in double gloving because of excess standardization, not having the appropriate gloves for the task at hand.
I think that's a really good point here. One of the things we did is we asked them, the same group of clinicians, about emotional distress that these glove failures cause, and here's what we heard. 85% experienced stress as a result of a glove failure caused by a tear, puncture, or a leak. And among them, nearly 1 in 5 said that the level of stress that they experienced was high or extreme. We also asked the same clinicians what additional impact excess standardization could have, and here's what we learned. Roughly 2/3 of these clinicians are concerned that excess standardization could lead to the following: putting a staff member at risk, putting patients at risk, increasing the cost due to hospital-acquired infections, and creating just generally a lack of control and influence over the decision-making. And so, Jane, I'd just be very curious from your perspective, have you heard clinicians say similar or like things?
Oh, absolutely, no question. And I personally have had exposures with infectious diseases during peritoneal dialysis in the intensive care units.
So, as we kind of talk more about this, there's one more statistic I'd like to share from the same survey that we did, is workplace incident reports. And it's astounding. Nearly 1 in 5 clinicians filed a workplace incident report as a result of a glove failure due to a tear, puncture, or leak. Remember, these are just the gloves that have been failures that have been reported. Rosie, Jane, anything you want to add here?
Yes, I agree. It's important that when you have an exposure, you take the time to fill out the incident report. The problem is many times when you're the most busiest, that's when an incident occurs. But still, you need to take the time to fill out the incident report so that there's a record of your exposure. But it's so often what I see is many times physicians and nurses don't want to take the time to do it. It's really important that they follow through with that incident report.
I agree, Jane. There are probably many more workplace incident reports that could be filled out by both nursing staff and physicians.
Thank you both for that. Now, let's move on to the third and final risk of excess standardization, and its financial impact. The potential for financial risks are real. Let's start by going into a little bit more depth around the pathological risk, including CDI, MRSA, hepatitis B, Hep C, and HIV. 2 in every 100 people carry MRSA. The CDI mortality rate is nearly 7% at 30 days and almost 17% at 1 year. CDI is thought to be transmittable via hand carriage, making a glove failure even more significant. And you might be asking yourself, well, what's that financial cost or the exposure and treatment? And that yields about $63,000 per patient.
I'd like to make an additional point about the financial impact. It doesn't take an actual glove failure to cost money. Just the threat of a glove failure is costly. Do you remember when I mentioned the anxiety that can cause clinicians to wear 2 or even 3 pairs of gloves? Imagine the number of times that exam gloves are needed in a hospital setting every day, and then how many more gloves are actually used by double or tripling. You can see the cost of how the double or triple gloving can really add up to the cost of the product over time.
Jane, I agree. I wonder if materials management and leadership are seeing an increase in cost as exam glove usage increases.
That's a really great point. You know, there's another financial impact that I want to talk about. That's a little harder to quantify, but it's just as real, and that's really the cost of losing employees because they feel underprotected and undervalued. The cost of hiring and training new employees, not to mention the disruption in patient care, can be significant. In contrast, we see that when employees feel protected and cared for, it improves how they feel about where they work. Happy and engaged employees are more likely to stay because they feel like they're part of something important. This can really help to motivate them to work more closely with supply chain to manage costs without impacting safety. Clinicians are faced every day with the daily reality of managing a P&L, but clinicians are not faced with the daily reality of managing a P&L, but if they understood the value of controlling costs, they may be more willing to help supply chain bring the standardization strategy back into balance.
Thank you, Samantha. I also like to comment on clinician satisfaction as well. All clinicians want to practice in a healthy practice environment. I've studied healthy practice environments my entire career, and what people want to see is that we're respected and we have the proper equipment to do the job that we need. Without both, the nurse and physician turnover rate can be higher. Can you imagine what the turnover rate is upon a large financial impact on an institution? It's staggering.
You know, that takes us to our next place, which is let's take a look at one hospital's experience using a glove that was too thin for the task at hand. Rosie, would you like to share some of the highlights of this case study?
Sure. This facility had standardized to 1 nitrile exam glove, which was used in all areas and on all floors. Since the decision was implemented, there has been many complaints from clinical staff and housekeeping of feeling marginalized with the facility's glove selection. The standard glove option was tearing and leading to exposure to bacteria, bloodborne pathogens, and common chemicals. In the ICU, clinicians experience glove tears that expose them to human waste while providing patient care. Several of the patients in this ICU had C. differential with symptoms of diarrhea. One of the nurses that experienced exposure was on antibiotics for dental care. Workers who are on antibiotics and exposed to C. diff at epidemic levels are at a higher risk of acquiring C. diff in the gut. This nurse expressed anxiety over exposure and anger towards the situation and had to report to occupational health for testing. She could not report back on duty until the test results were confirmed.
You know, Rosie, you've shared many stories, but this is just one example of the consequences of excess standardization. And many of you may have stories of your own, and they all point to the critical role of exam gloves in protecting clinicians and the necessity of having the right level of protection for every clinical setting. You know, what role should exam gloves play in protecting staff? They are a first line of defense. So let's look at 2 leading authorities for their perspective. First, the Center for Disease Control. Gloves can protect both patients and healthcare workers from exposure to infectious material that may be carried on the hands. OSHA says it's the employer's responsibility to identify hazards and provide PPE that is adequately protective. The glove selection must also be based on the hazard. When it comes to choosing an exam glove, we asked the clinicians in our nationwide survey to tell us which type of high-use nitrile exam glove they would prefer, thicker or thinner. And because of that, I want to ask you the same question. So all our clinicians on the screen, do you prefer a thicker or thinner high-use nitrile exam glove? All right, let's see what the survey says. So our webinar polling results say that 62% of you who responded prefer a thicker glove and 38% of you prefer a thinner glove. Jane, do you have any comments on this?
Well, as I mentioned earlier, that OSHA recommends the absolute thickest glove available that still has the right amount of dexterity for the task at hand. This just makes common sense.
Thanks, Jane. Let's take a look at how our poll results compare with the broader nationwide audience. We asked survey respondents to tell us whether they prefer a thinner or thicker high-use nitrile exam gloves for three key attributes: overall satisfaction, level of protection, and glove strength. And here's what they said. When it comes to overall satisfaction, nearly twice as many clinicians were very or extremely satisfied with their thick nitrile glove. Nearly 150% of them found that the level of protection to be very or extremely acceptable. And when it comes to strength, nearly 250% more preferred thick versus thin nitrile gloves. Rosie or Jane, from your clinical experience, what is your preference?
Well, I prefer a thicker glove that I can count on to perform the task at hand and the protection that is required. What are your thoughts, Jane?
Absolutely. Thicker is definitely better as long as you still have the dexterity you need.
So, as I said, gloves are truly that first line of defense, but excess standardization can potentially weaken the defense. So what can we do to overcome it? The solution we see to the challenge of excess standardization is creating a risk-adjusted mix of high-use and specialty nitrile exam gloves. To calculate this mix, we've worked with 7 of the top 20 U.S. hospitals as identified by the U.S. News and World Report, and the resulting mix is approximately 90% high-use and 10% specialty. With this mix, you're better able to offer the right level of glove protection for each patient engagement and help improve employee safety. For everyday clinical needs, you'll have the high-use gloves that can align with the level of protection needed. Then when you need clinical protection designed for specific high-risk applications, you'll have the right specialty exam glove available. Examples of high-risk situations include potential exposure to blood or bodily fluids and chemotherapy drugs, as well as disinfection or chemical agents. With the appropriate mix of high-use and specialty gloves, you'll be in a better position to support the clinical and patient satisfaction. At Cardinal Health, we help our customers design the right glove mix for them, choosing from the broad portfolio of high-risk and specialty solutions. In addition to that, we also hear many of our customers choose our gloves to help overcome their concerns about a leading cause of glove failures, and that's cuff tears. 29% of surveyed healthcare providers chose Cardinal Health exam gloves over the competitive options for the resistance to glove tears. One way we do that is by improving our glove elongation, which can help to reduce cuff tears while donning. Cardinal Health also offers other glove innovations to address issues such as concerns with latex allergies, chemical accelerants, and chemotherapy drugs. Rosie, I know you have firsthand experience in working with our gloves. I'd really like your perspective on this.
I am excited to say that we recently completed glove trials with our Esteem Comfort nitrile gloves at a very large IDN. 4 of the ICU departments have been experiencing glove tears and exposures while using a thinner nitrile glove that the entire facility standardized with. The Esteem Comfort has a minimum elongation of 650%, which helps to reduce cuff tears during donning. The glove is comfortable and reduces the risk of developing a type 4 hypersensitivity to chemical accelerators. Here is what some of the nursing staff said on their evaluation. I feel more protected in these gloves. I am not having any issues with the cuff tearing. I can wear these for 20 to 30 minutes and complete bedside care without any issues. These gloves are really comfortable. In the other gloves, I was having some sensitivity and have no redness with these gloves.
I think that's a great story, Rosie. Thanks for sharing. You know, it's safe to say that not all gloves are created equal, and there's a growing awareness that one exam glove isn't the right fit for all situations. The objective is to choose the right glove for the right situation without sacrificing safety or savings, and the ultimate goal is to bring your standardization strategy into balance, creating the optimal mix of high use and specialty gloves for your facility. In short, you don't have to choose either glove, safety or savings. You can have both. Cardinal Health has a track record of implementing this approach with 7 of the top 20 U.S. hospitals. In our experience, there are 3 keys for developing a risk-adjusted glove mix strategy. 1, match the glove strength with the clinical setting need. 2, leverage glove usage analytics to recommend a standardized and clinically appropriate glove selection. And 3, seek a proven system for streamlining the conversion process. Jane, anything you want to add as we wrap up?
Well, I think most importantly is to leverage the glove usage analytics to help you know exactly what kind of product you should be using.
So Jane, as you kind of think about the risk of using the wrong exam gloves, and they are real, tell us a little bit more from your perspective.
So the risks of using the wrong exam gloves are real. We've discussed the new pathological agents that can expose clinicians to new hazards. We've talked about the emotional stress that can result from these exposure incidents. And we've learned about the potential financial consequences to the healthcare system, from the cost of treating an exposed patient to the everyday cost of double or triple gloving, which continues to add up to the cost day after day. Gloves are a viable first line of defense. To maximize their effectiveness, it's vitally important to choose the right glove for the right setting. I can't emphasize that point enough. Remember that the skin is the largest organ in our body and is also our first line of defense for our immunity system that keeps us healthy.
Thank you, Jane, for that point. And thank you, Jane and Rosie, for both being here with us today. And I'd like to thank the audience for your attention today. So if you want to learn more, we have several tools that can help. For example, we have a glove selection matrix that can help you more easily identify which exam gloves are designed for which uses. And we'll be publishing a white paper shortly that summarizes everything that we've been discussing today. So watch your email to find out when that white paper will be available. Also, please take a moment to complete the survey we've given each of you. Your feedback is invaluable in helping us to continue to improve the value that you receive from discussions such as this. And I'm going to turn it over to Brian for the question and answers.
Thank you, Samantha, Rosie, and Jane, for that fantastic presentation. We will now begin today's question and answer session. Please submit any questions you have by typing them into the Q&A box you see on your dashboard. We've had several good questions come in already, and we're going to get started with this one from David. David asked, with USP 800 going into effect, what are some of the requirements for exam gloves?
David, great question, and I'm glad you brought that up. You know, there's a flyer on this topic available on cardinalhealth.com, and it can be found in the specialty portfolio section of the exam gloves product page. But let me just give you an overview of what it really says. And it really is, this chapter describes practice and quality standards for handling hazardous drugs to promote both patient safety, worker safety, and environmental protection. So handling HDs includes, but is not limited to, the receipt, storage, compounding, dispensing, administration, and disposal of sterile and non-sterile products and preparations. And I know that's a whole lot. But let me talk about the standards in a little bit more depth. So standard number 1 is chemo gloves should be worn for handling all hazardous drugs. 2, 1 pair of chemotherapy gloves are required for unpacking HDs. 2 pairs of chemotherapy gloves are required for either compounding, administering anti-neoplastics, or also deactivation, decontamination, cleaning, and disinfection activities in HD handling areas. The 4th standard is the chemotherapy gloves must meet the ASTM D6978 or its successor, and that they must be powder-free. Standard number 6 is when used for sterile compounding, the outer chemotherapy gloves must be sterile. And the 7th standard is that chemotherapy gloves should be changed every 30 minutes. To comply with these standards, your institution may need to make changes to prepare for the storage, transportation, administration, and disposal practices of HDs before December 1st, 2019, the enforcement date. Also, for those of you that might be interested in learning more, Cardinal Health will be presenting in a webinar, USP 800, in August. So please make sure to visit the website for more detail. David?
Thanks for that clarification. Yep, there's a follow-up question here.
Sure.
So David's wondering, how can I determine if an exam glove meets ASTM D6978?
This is a great one. So it should be indicated on the box along with the data for the drugs that were tested. So for example, on our Cardinal Health exam glove packaging boxes, it has permeation data tables that state the following for like chemotested gloves. So for example, it says this glove has been tested for the resistance of permeation of various chemotherapy drugs per the ASTM D6978. Standard practice for assessment of resistance of medical gloves to permeation by chemotherapy drugs. It will also give you a caution, and it will tell you that these gloves are used for the protection against chemotherapy, drug, and laboratory chemical exposures, and should be selected specifically for the type of chemicals being used. Note that you should review your exam glove permeation data tables to determine the required level of protection for the chemicals and the drugs being used.
Excellent.
Brian, do we have any other questions?
Yep.
Yeah.
And we've got another question here from Becky. Becky wonders, what should hospitals look for when evaluating high-use gloves?
I like that question. So, hospitals need a glove that will provide protection and comfort. It needs to give the clinician the right fit, the right feel, and a level of comfort that when they are performing their job, they can do it without even thinking about the glove. It must also be durable and tactile. So it's usable through most of the hospital. There's one particular high-use glove from Cardinal that comes to mind, and it's our Esteem Comfort Glove. And it provides protection, is tactile and durable, and fits comfortably. This glove also has an FDA-approved low dermatitis potential claim and an elongation like latex, which can help reduce cuff tears during donning. In addition, it has some of the greatest chemotherapy and chemical resistance exhibited by high-use style exam gloves in the marketplace.
Great. And so our final question today is going to come from Julie. So Julie wonders, how can a hospital determine if they are purchasing a clinically appropriate specialty glove?
So there are special needs in almost every healthcare facility. So for example, many places administer or compound chemo drugs, including the oncology unit, the pharmacy, and maybe even an outpatient clinic within the system. In these instances, when handling chemo drugs, you need a glove that will help the facility comply with the USP 800 standards. In addition, the American Society for Testing Materials has a very specific methodology for testing against chemo drugs. So a hospital can ensure that the glove is clinically appropriate if it meets the ASTM standards. And lastly, Cardinal Health has developed a variety of resources to help hospitals determine if a glove meets the various standards. We call this the Clinical Matrix Quick Reference Guide, and it can be found on our cardinalhealth.com site, along with other flyers and information about our glove.
Thanks for sharing that helpful information there. And that's all the time we have for today. I want to thank Samantha, Rosie, and Jane for their excellent presentation, and Cardinal Health for sponsoring today's webinar. Enjoy the rest of your day, and we look forward to having you join us for future webinars.